Hello. Good to have a chance to talk with you all about the COVID-19 vaccines. This is Dr. Ellis. I know I don't look the same as I did last year. I've been through COVID world, of course, but I'm going to be talking to you all today about the COVID-19 vaccines and some of the myths associated with the vaccines, and try to answer some of those questions for any of the people that are still hesitant about getting a vaccine. As you might know, we sent out a survey to all the people that work at GHS, and we have around 500 employees, and perhaps almost 70% of the employees returned the survey. And during that survey, about 80% of people said that they had already gotten at least one dose of the vaccine and were going to finish up the vaccine series. But we may not have heard from everyone because only about 70% of people returned the surveys. And we're trying to get as many of our staff vaccinated as we can. So I'm going to address some of the common myths that I've heard about the COVID-19 vaccines, and hope that that can help some of the people that are still on the fence with regard to using these vaccines. First off, let me say that I got myself vaccinated as soon as I possibly could, and I got all the members of my family vaccinated as soon as I could possibly get them vaccinated. Some of them were under 18 and had to wait until the Pfizer product was authorized for lower age groups. So all my family has had the vaccine, all different ones, in fact. So there's, as you know, 3 that are currently approved under emergency use authorization in the United States. That's the Pfizer product, the Moderna product, and the Johnson & Johnson product. The Pfizer and Moderna vaccines are messenger RNA vaccines, and the Johnson & Johnson vaccine uses an adenovirus vector to accomplish its goal of immunity or partial immunity to the COVID-19 virus. So first off, I've heard some people worried that you can get COVID-19 from the vaccine. And since the vaccines only contain messenger RNA that codes for the spike protein on the virus, you can't actually get COVID-19 from the vaccine. I think some people might think this is possible because they've heard people getting some symptoms from the vaccines. Turns out that the symptoms that you get are just proof that your immune system is responding to the vaccine. So the most common side effects that you hear people getting: arm pain, which is common even with the flu vaccine. Sometimes you can get chills, possibly a low-grade fever, although that's relatively uncommon, headache, and fatigue. Those are some of the common side effects. And since that sounds a little bit like some of the symptoms from the illness, I think maybe people wonder if it is, quote, giving them the illness, but it does not. So you cannot get COVID-19 from the vaccine. Also, I've heard that people are worried that the COVID-19 vaccines have been shown to cause infertility. And this is also not true. There's no reputable, let's call it, no reputable scientific study that shows this. The vaccines actually haven't even been in existence long enough for someone to do such a study. But that's false, in that there's no study that has shown that to be true, and there's no reason to believe that's true, that they would cause infertility. These myths that I'm talking about are believed by somewhere between 15 and 35% of the population, and it varies a little bit based on how old you are, perhaps your political affiliation, and also ethnicity. So another one that I've heard is that the COVID-19 vaccines contain fetal cells. Well, that also is not true, although it is fair to say that that there are things called fetal cell lines that are cells grown in the laboratory, and these are sometimes used in research. And the Pfizer and Moderna product did perform confirmation tests to ensure that the vaccines work using fetal cell lines, but there's no fetal cells in the vaccine. And Johnson & Johnson used fetal cell lines in development and in confirmation tests to ensure the vaccines work, and in production. But again, there's no fetal cells in the vaccine product those were used in production or confirmation testing. So there are some people that have a religious prohibition against using any product that is in any way connected to fetal tissue. Fetal cell lines are not really fetal tissue, in that these cell lines are thousands of generations removed from the original fetal tissue, and they don't contain any tissue from a fetus. So that's a long answer, but that's the answer to that question. Another one would be, you should not get the vaccine if you've already had COVID-19. Turns out that that's not true, and that the CDC and doctors recommend that you do get the vaccine once you've recovered from COVID-19. The current waiting period, I believe, is 3 months. I think that generally speaking, you could assume that you have immunity from the illness itself for several months, although the time frame for that is not known. And if you've already had COVID-19, you then should get the vaccine to have a higher rate of immunity to keep from possibly getting reinfected. Coronaviruses are known to cause an antibody response and a T cell response, but those responses in terms of the antibodies wane over time, and we really don't know how long these antibody responses are protective. It's fair to say that we also don't know how long the antibody responses and T cell responses to the vaccines themselves are protective, and that's still an ongoing area of research. But you should get the vaccine if you've already had COVID-19, because you're likely to have a more robust immune response in producing antibodies to the spike protein, which is known to be a neutralizing or virus-killing, infection-preventing antibody. Another thing I've heard is that the COVID-19 vaccines can change your DNA. This also is not true. The vaccines are from Pfizer and from Moderna are messenger RNA vaccines, and the messenger RNA is delivered in a lipoid envelope, and it does not enter your cell's nucleus, so it cannot interact with your DNA, so it certainly can't change your DNA. It's a strand of messenger RNA, and all your body does is transcribe that into a stabilized form of the spike protein, and then you form antibodies against that spike protein. So those are some of the myths that I've heard. You can't get COVID-19 from the vaccine, although you can get some mild side effects. They don't cause infertility. They don't contain fetal cells. You should get the vaccine even if you've already had COVID-19, and the vaccines cannot change your DNA. When you ask people that are unvaccinated these questions and say, have you heard these myths? And do you believe at least one or more of them are true? 2/3 of them say that they have heard these myths and that they believe that it's true, or they can't say whether it's true or not. So those are some of the issues that have come up in vaccine hesitancy. And, another thing to consider is that for GHS employees, we are a healthcare facility and we treat patients. And in healthcare facilities, there's frequently a higher focus on the idea that the people that work there should be safe to be around. And certainly you're safer with regard to the transmission of COVID-19 if you've had the vaccine. The vaccines are 95% effective in preventing you from getting symptomatic COVID-19 infection. That means there's about a 5% breakthrough rate. And these percentages that they found in the extensive studies done on the vaccines have been borne out in real world studies also, since they've been given to almost half of the US population. The vaccines do have another, I guess you could say, positive that you can count on. That is, they tend to prevent severe illness with COVID-19, and they tend to prevent death. The two outcomes that people are the most worried about are, I'm going to get a severe case of COVID-19 and end up in the hospital, or I'm going to get a severe case, end up in the hospital, and pass away on a ventilator. These vaccines mitigate that risk to almost zero. So what do you get from getting the vaccine? You get 95% protection, and you get almost 100% protection against severe illness and death. And you're also contributing to the general health and well-being of patients and staff that work here at GHS. And these effective and safe vaccines are widely available, and it behooves us to get more of our staff and patients vaccinated to give us the best chance that GHS remains a safe workplace. I'm sure all of you have heard about the variants, that is mutations from the original natural virus. And I'm sure you've heard that some of these variants are more transmissible and some of them are even a little bit more dangerous. And how this pans out across time is going to partly depend on whether the vaccines protect against these variants. Most of the studies at present suggest that the current vaccines do protect against these variants. And so, again, I hope that these issues that we're going through today help you reconsider and take a look at getting the vaccine. And I encourage you to read the information on the CDC website with regard to the vaccines, and to consider getting the vaccine for your own health, the health of your family, coworkers, and the patients at GHS. And I thank you for your attention.